Hey everyone, it's Dr. Craig Dingman from Elevate Chiropractic. I wanted to just describe a conversation I had yesterday with a good friend of mine as we sat on our spinning bikes about to undergo a painful spin class. He said, "Hey Craig, I really wanted to thank you for letting me know there were options to rehab my knee as opposed to surgery." See, about 3-4 years ago, I'd had two meniscal tears, had an MRI, went to the surgeon and was told I absolutely needed knee surgery and would have to have a portion of my meniscus, the cartilage, removed. And I chose to just put that off and rehab it. And that's about 3 years ago. And to this point now, I couldn't even tell you really, like I remember which knee hurt, but I couldn't tell you based on symptoms which knee I had had the problems with. They're both 100%. And my friend yesterday recounted the same thing. He had pretty bad knee problem maybe 8 to 10 months ago. It was in a lot of pain, had the MRI, went to the surgeon, was told he would definitely need surgery. And we had a discussion. I'd forgotten about it until he mentioned, but we had a discussion. I basically said to him, "Hey, maybe you don't need the surgery. Maybe you could rehab this first." And there's no downside to rehab because even if you do need the surgery, if you do the rehab work in advance, the surgery will go better for you and you'll recover faster. So as we sat on the bikes yesterday, he said, "Hey, thanks for telling me about these different rehab strategies for my knee," because he says, "I'm 100%. He said, "I don't even notice it anymore. They told me for sure I would need surgery, and now I feel fine. No problems whatsoever." He was obviously really, really excited. It's a conversation I have with patients all the time, especially lately now that the weather is changing. People are getting outdoors, they're being more active. We've been sedentary through the cold winter, and you're bound to have aches and pains because you're starting to move and be active again. A lot of people talking about their knees bothering them lately. So there are three things that are really critical for any knee problem. One is to get on a stationary bike and do some cycling. Very light tension, really easy spinning, but a stationary bike is going to be a crucial way of rehabbing your knee. People are reluctant to this. They think the knee is going to get aggravated by cycling, and you put light tension on, you do 10 or 12 minutes a couple times a day. It's fantastic for your knee. You want to make sure you've got the bike set up right. So your seat should be adjusted so that when your foot is in the downstroke, you have a very slight bend in your knee. You don't want it straight, and you don't want a real severe bend. You want to be able to almost extend your knee and have a bit of an angle left in your knee when it's at the downstroke. And I would say 10 to 12 minutes a few times a day, more if you like, if your knee can tolerate it. Depends on which stage you're at in the healing. The other one is to do some squats. And every time I talk to people who've had knee problems about squatting, they just cringe. Maybe they've been told that they shouldn't squat, especially deep squats. I have to say that squatting is one of the most critical things in order to help your knee recover. Now, again, you've got to squat in a way that's safe for you and appropriate for your level of healing or injury. And one of the best ways to do this, and anyone can do this modification, is if you use an interior door in your house and you open the door to about 45 degrees, so it's sort of halfway open, and face the door end on. So you'd be looking at the door end on. And if you look at the door, you'd be staring then, if you look down a little, you'd be staring at a doorknob on either side. Put your feet about shoulder width apart, toes very slightly pointed outward. Reach forward and you're going to grab the doorknobs like this, and then you can safely squat. And if you get down too low and your knee starts to bug you, you can just use your arms to pull you back up. It's a way that you can get deeper in your squat because you can cheat a little and use your arms. You go through more of a knee range of motion. It'll really help strengthen and rehab your knee. And the other most basic way, the third exercise that everyone can do, even someone with a brand new knee injury, is just to swing your knee. The primary way that a knee moves is just up and down, extending and flexing. So you can do this at home if you have a stool or a chair that's a bit higher so you can swing your leg freely if you're sitting and that your heel won't scrub the ground. So you can imagine a bar stool or something like that. And you just swing your knee open and closed freely. Just picture in your mind a little kid sitting on the end of a dock, his foot just going forward and backward like this along the water at the side of a pool. Well, people do that. They just extend their knee and flex it, just sort of open and close like this with your knee. Do that several times a day on your bar stool if you have it at home. Anyone can start with that. But there's three things that are going to help you rehab your knee pretty much regardless of what kind of injury you have. If you need any more suggestions, you have questions about your specific issue, feel free to message me. Dr. Craig Dingman, Elevate Chiropractic. Have a great day.